Welcome to this explainer. If you or your partner are navigating male infertility right now, you know exactly how overwhelming all the medical terms and treatment options can feel. It's a lot. But you absolutely do not have to navigate this in the dark. Today, we're breaking down a very specific, highly effective procedure offered at ART Fertility Clinics. It's called fine needle aspiration, or FNA. So let's explore exactly why this is a safe, manageable, and deeply hopeful step in your fertility journey. Here's a quick roadmap of what we're covering today. First, we'll talk about hope for male infertility. Second, what FNE actually is. Third, we'll look at how the procedure works. Fourth, we'll cover the safety and recovery effects. And finally, your path forward.
Okay, let's dive into this. Section 1. Hope for male infertility.
Receiving a male infertility diagnosis, man, it carries a heavy emotional weight. But honestly, understanding the mechanics of what's happening can be incredibly empowering. For example, one common condition is called obstructive azoospermia. Now, I know that sounds super intimidating, but it literally just means that sperm is being produced perfectly well, but it's blocked from traveling naturally. Think of it like a roadblock on a highway. The cars are all there, the engines are running, they just can't get through the tunnel. The really reassuring news here is that the experts at ART Fertility Clinics know exactly how to completely bypass this roadblock.
Moving right along to Section 2. What is FONA?
So, fine needle aspiration, or FNA, is a minimally invasive technique. It uses a very thin, hollow needle to gently collect sperm directly from the testicles. I really want to emphasize those words for a second. Thin needle and gently collect. This is not some major surgery. It's just a highly targeted way to retrieve exactly what is needed to help you start your family.
And this brilliantly illustrates why FNA is such a game changer. Older methods, like a traditional surgical testicular biopsy, require an actual cut in the skin. That obviously means it's more invasive, and you're looking at a longer recovery time. But with fine needle aspiration, no cut needed. By completely eliminating the scalpel, this outpatient procedure maximizes your comfort and totally takes away the stress of a long, painful recovery. All right, Section 3, how the procedure actually works. Often, the absolute hardest part of any medical visit is just the fear of the unknown. So let's completely remove that anxiety by walking through the exact steps you'd experience at the clinic. First, local anesthesia is applied, making sure you are completely comfortable. Second, a trained specialist gently inserts that thin, hollow needle we talked about. Third, a syringe carefully extracts the sperm and a tiny little tissue sample. And finally, that sample goes straight to the laboratory. That's the whole shebang. It's an incredibly routine sequence that trained fertility specialists or urologists perform safely every single day.
Which brings us to Section 4, Safety and Recovery Facts.
Now, seeing those clinical steps naturally leads to the absolute most common question we get from patients. Is fine needle aspiration safe? And hey, this is a completely valid, entirely natural concern to have. Whenever we talk about medical procedures in sensitive areas, feeling a bit anxious is totally 100% normal. Well, the answer is a resounding yes. Because it's an outpatient procedure with absolutely no skin incision required, your discomfort is drastically minimized. You're completely awake, but under local anesthesia, so you're numb to the pain. All of this translates to a beautifully low risk of any pain, infection, or complications.
Now, what's really interesting to note here is this number, 15 to 30. That represents the total minutes the procedure actually takes. From start to finish, that's it. Because it's so incredibly brief and minimally invasive, you get to go home the exact same day with virtually zero recovery downtime.
Finally, Section 5, your path forward. So we've covered the clinical steps and the safety facts, but let's connect this back to the ultimate, hopeful goal of why you're doing this in the first place. The FNA procedure is really just a stepping stone. Once the sperm is safely extracted, it gets immediately evaluated by an expert embryology team. They prepare it for a highly advanced technique called ICSI, or intracytoplasmic sperm injection. Essentially, the lab directly injects the absolutely healthiest extracted sperm right into an egg, maximizing your chances of a successful fertilization and helping you build your family. I want to wrap up by sharing this really authoritative quote from ART Fertility Clinics. They describe testicular FNA as the simplest, the most rapid, inexpensive, and overall the least invasive technique for obtaining testicular samples. When you choose this path, you're literally in the hands of top-tier professionals, like Prof. Dr. Human Fatami, who use the absolute best, least invasive methods available to protect your comfort and, more importantly, your future.
So we have to ask you one final question. Knowing that it takes just 15 to 30 minutes, requires zero painful incisions, and is a completely safe outpatient procedure, are you ready to confidently take this next step toward building your family? That physical roadblock we talked about way earlier, it can absolutely be bypassed. We really hope this explainer has provided you with the clarity, the comfort, and the confidence you need to move forward without fear. Thank you so much for joining us, and we wish you absolutely nothing but success on your fertility journey.